Good morning. My name is Scott Gardner. I'm the Associate Executive Director for AdCare Educational Institute of Maine. And I got to take advantage of being on the stage to shout out my amazing team, especially Lorena Liberty for providing the logistics for today's event. Our organization is very honored to be a part of this event and also the work that we do providing training and technical assistance to the behavioral health workforce to provide evidence-based services in the state. I'm also the director for SAMHSA's New England Prevention Technology Transfer Center, where we provide training and technical assistance to the prevention field here in Maine and the rest of the New England states. And we are a proud sponsor of this morning's prevention keynote speaker. When Gordon said there was going to be a prevention focus for this year's summit, and that we would need a dynamic, well-versed prevention expert to come to the stage to talk about the importance of prevention in this work, I knew immediately who to call, my good friend Carlton Hall. So I'd like to introduce him to the stage. Carlton Hall is the president and CEO of Carlton Hall Consulting, LLC, a multifaceted, full-service consulting firm designed to provide customized solutions, enable measurable change for communities, organizations, families, and individuals. Carlton spent 12 years with the Community Anti-Drug Coalitions of America, otherwise known as CADCA, serving in several leadership positions, and including most recently acting vice president of Training Operations and acting director for CADCA's National Coalition Institute. Carlton also supported CADCA's international programs in partnership with the U.S. State Department's International Narcotics Law Enforcement Division, managing training programs in Kenya, South Africa, and Ghana. Carlton is one of the primary architects of CADCA's National Coalition Academy. The Academy, a year-long coalition development program, is designed to increase the effectiveness of communities in drug demand reduction, producing population-level outcomes. With more than 25 years' experience in the fields of government relations, social services, and prevention science, Carlton first gained national prominence as the Communities That Care project manager for the Channing Bed Company, where he was a training senior consultant for 4 years. He received his master's in human services from Lincoln University in Pennsylvania. He was appointed as a project director for the Communities That Care process in Philadelphia, as well as the crime and public safety manager for the Philadelphia Empowerment Zone, a division of the Mayor's Office of Community Services. During that time, he managed a small planning grant to over $3 million for science-based prevention programming in the neighborhoods of Philadelphia. So please help me welcome to the stage Carlton Hall.
All right. Well, good morning, everybody. All right. Yeah, that's it. Let me just start off. If you won't mind, this is kind of cool being right here. This is my first stadium gig, if you will. I feel like Beyonce. Maybe not, maybe not. It is such an honor, privilege, to be able to be here to share some thoughts that I have. I don't come here, and I'm not coming with the charge and the expectation of providing for you, some method and some tool and all of that. I'm not going to speak about statistics and data that I have read the agenda and am confident you are going to receive all that vital information throughout the day. I'm coming here today for some very selfish reasons. I'll explain that a little bit more as we go further, but I believe that this conversation that we're about to have is one of the most important conversations that I've been trying to have across this nation, and I am truly honored to have been extended an invitation to share this conversation with you. So thank you for who you are. Thank you for the invitation. I look forward to having this conversation with you. If you wouldn't mind, could you help put your hands together to help me thank those who have been a part of organizing this. Your extraordinary governor, the great and tremendous leadership of Gordon, and my friends at AdCare. They're going to kind of hate that I'm even bringing them up because they do their work quietly, but if you wouldn't mind, could you help me thank the extraordinary gifted leaders that you all are privileged to have here with AdCare right now. They do tremendous work, Scott and the team. When I shared to folks that I was coming to Maine to have this opportunity to be with you all, I was surprised because many of them said to me, Maine, they're different up there. And that kind of took me aback. I'm like, what? What are you talking about? And they said, they're different. It's different up there. And I had no clue what they were sharing, no clue what they were talking about until I got off the plane and came out and Scott was there to pick me up and I saw pheasants outside of baggage claim, which is a little bit different for me. But it is an extraordinary state, an extraordinary community. And when I was actually researching to find out who I would be speaking to find out what it is that you all have been doing, to find out about this extraordinary effort that you all have had, and the fact that this amazing conference is the 5th time that you've been able to come together and convene such leadership. When I did my research about who you all are and what you all have done, I found out why they say Mainers are different. I'm here to share with you that I do this work across the nation, and I've had the privilege and opportunity of working with states all across this country. And I can stand here firmly, my knees don't shake, my ankles don't quake, when I tell you that the extraordinary, genuine conviction that I've seen in practically every episode and every aspect of all the things that I've seen you do here in Maine is unmatched. You all are extraordinary. It's different here. Your passion, your conviction is palpable. And so that led me to share that as we learned some extraordinary things from your remarkable U.S. Attorney and State Attorney General and our remarkable leader for the behavioral health efforts. I'm here to share with you that I want to talk to you about the role of prevention. And that's a little bit different because prevention sometimes is a little bit difficult and challenging to grasp and to get a hold of. And so I want to start off a little bit different. If Mainers are different, I'm going to be different. I'm going to start off a little different. I want to start off, if I could, with a bit of a game. I like to invoke a little fun in the conversations that I had. Maine, are you willing to have a little bit of fun with me as we have this conversation? Fantastic. I promise you it won't hurt. I promise you it won't hurt, but it will have a point. I'm going to ask you a simple question. Let's just do this. The tablecloths. What color are the tablecloths? I promise you no trick questions. All right? What color are the tablecloths? How do you spell white? I promise you no trick questions, and I promise you that there will be a point. What I want to do is start this conversation. I'm going to ask you a simple question. I want to ask you, what color are the tablecloths? I want you to say white 3 times. I want you to spell it 3 times and say white again. And at the end of that, I'm going to ask you another simple question, and we see what we come up with. Are you willing to play with me? Yes. Fantastic, man. Thank you so much. What color are the tablecloths? White, white, white. W-H-I-T-E, 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 white. What do cows drink? Yeah. I grew up, born and raised in Philadelphia, Pennsylvania. And I realize I'm a city kid, and there aren't very many cows where I come from. But when's the last time you all saw a cow drink a glass of milk? So why did I do that? Why did I do that? I did that for two reasons, actually. When I was actually first introduced to this issue and this challenge and to this work of prevention, a man by the name of Dr. Khalifa Ramadan stood in front of the group and did that. And I was actually so proud of my answer. I actually jumped up and yelled, "White milk!" Now, it's one thing to be wrong. It's another thing to be both loud and wrong at the same time. But it was also, and I swore to myself that I would always use this, but I said to myself, it was also an exercise in conditioning. And all I did is I spent 10 seconds, 15 seconds to condition us all to think about the color white. And based upon that conditioning, I asked us all a very simple question, and don't worry, what happens in Portland will stay in Portland here. But my question to you is, how often are the responses that we are providing to the very simple questions that are being asked of us, how often are they colored by the way we've been conditioned to think? Really, the goal of this remarkable summit is just this. Every single one of you knew what the answer was. But what did it require? It required us to stop, to think first, and then respond. And what this summit is gearing us to do is providing for all of us the opportunity to stop and think first as we respond to this issue. And part of what it is that I want to offer you with respect to prevention and prevention's role in this is prevention provides for us the tools to be able to help our communities stop and think and respond appropriately. Does that make sense to anybody here in the room? And so I'm here to share with you, and if we can bring the PowerPoint back up. Perfect. I'm here to share with you some thoughts that I have. And this is the first that I want to offer you, that if you don't hear anything else that I say today, remember this, that the role of prevention is for us to be disruptive, right? Disruption, and I love this because I got this definition from Facebook, so don't judge me. I just like it. But I love what she said. She says, disruption means to prevent something from continuing or operating in a normal way. How many of you will agree with me that there are some norms that are requiring disruption here in our state? So the goal of prevention is to be disruptive. So this is idea number one. Idea number two is actually offered to us from this remarkable author, Simon Sinek. Many of you may be aware of Simon Sinek and his work. He is a leadership guru of sorts, has become very, very well known with respect to his seminal work, Starting with Why. And I'm sharing this with you because he offered this idea that I think has real resonance for those of us here in this work of prevention, and that is people don't buy what you do, they buy why you do it, right? And it's this notion that we are really, really good at expressing and explaining the what's that we can do. We can talk to you about the 6 stages of this and the 5 strategies for that and the 6 efforts of this. But if we are going to engage those that are outside our typical population in order to make sure that we're bringing about change, we have to find those folks that believe what we believe. That is the essence of what Simon Sinek was sharing with us. And so I relate that to prevention because it forced me to ask this question, well, what is it that we believe? As preventionist, and what I will share with you is that I believe in three things. Number one, first and foremost, I'm a preventionist. I stand proud when I talk about this, and that means for me that I believe that the most important way and effective way of addressing any problem is to prevent that problem before it starts. Secondly, I believe in the full engagement and empowerment of the community in their role in helping us first understand the context of that problem, but also be a part of the solution of that problem. And three, I believe in being guided by science in order to produce population level change, right? Which is intriguing for me, which is interesting for me. How do we make sure that we are moving the needle for the entirety of our population? So I'm guided by these three core value beliefs. I don't think that there's anyone in this room that would disagree with anything that I have on the screen, right? I don't believe that there are folks outside of this room that would disagree with what I have on the screen. So what is the issue and the challenge for us as we try and we present ourselves as ways in which folks can help to ameliorate the issues and the situations that we were in? I'm going to start off by sharing some good news with us, right? So there is some exciting information that we are able to share in that there's been a recent study that suggests to us that prevention works. We have a peer-reviewed, peer-published study that suggests that increasing numbers of adolescents are choosing abstinence in the efforts that we are all caring about. What does this mean and how does this show up? I just want you to take a look at this chart. Now, each of the lines represents a different substance, and I don't want you to figure out or pay too much attention in what those actual substances are. The point that I want to get you to see is what way is the trend line going in a positive direction. This is over decades of looking at this information from the Monitoring the Future surveys, right? If we were to flip this and look at no use of alcohol, cigarettes, marijuana, or other illicit drugs by high school seniors over the course of these several decades, look at this trend line. Which way is it going? In a positive direction, right? And this goes up to 2018 now, and there's been a new study that just came out. I just added this last night because I wanted to see if this had actually been advanced, and you can see that the trend line is continuing to go in a positive direction. These are young high schoolers who are saying that there's no use of alcohol, cigarettes, marijuana, other illicit drugs, either in the last 30 days or over the course of the lifetime. What does this mean for us? Well, what it means is that substance use among our young people is not inevitable, right? First and foremost, we have an opportunity here as preventionists, as those of us who are caring about ensuring that we are creating healthier lives for our young people, to build upon this trend. What I want to share with you is that contrary to much of the reports out there about our work and our efforts not availing too much, that we are indeed having success in the efforts and the works that you all are a part of doing. And we don't hear about those successes as much as we should. Can you all agree with me and see yourselves in the role that you're playing in making this a reality for our young people? Give yourselves a round of applause for the tremendous work that you all are doing. I want to start off with this because I want to share with you that at one point in time, every 3 high school seniors out of 100 were reporting that they were abstaining from substance use. Now, that is every 3 out of 10. That is remarkable, remarkable progress that has been made that we don't often think about and hear about. And so I want to start off with that, but I will share with you that the way I think about prevention has changed and has changed dramatically over the course of the last few years as a result of this. Much of my change in the way that I look and view prevention is a result of the fact of a radical change that happened in my life. Some 6 years ago, my life and my world changed irrevocably. My wife and I became grandparents for the very first time. And I don't know about you, but if there are any grandparents that are here in the audience, you already know what I'm about to say. When you become a grandparent, everything changes. It is like God has this gift for you that you can't open up until you become a grandparent. And when you open it up, what you find is that there's this whole new level of love that you never knew existed. My son and his wife gave us our first grandchild, my grandson, Ethan. And then 10 days later, my daughter gave birth to twins. And so, yeah, if you're doing the math, we went from 0 to 3 in 10 days. I don't know how y'all do it up here, but that's apparently the way it worked for me, where we came from, right? And they call me Babu. Babu is Swahili for grandfather. And so there's no sweeter sound than to hear those grandkids say, Babu, Babu. So when I go to my children's home to visit my grandkids, I'm expecting the heavens to open up. I'm expecting the trumpets to declare because Babu has arrived. But this is what I find. I find that even though I have a couple of degrees, for the life of me, I can't figure out how to open up that doggone thing and navigate the stairs. And because I get hungry every night, when I get downstairs, I can't open up a doggone cabinet to get myself a peanut butter or jelly sandwich. And I can't for the life of me figure out how to charge my phone in their house. And doggone it, I don't mean to be rude and crude here, but I'm over 60 now, and there are just some places that should never, ever be restricted in my view. I'm just saying, right? Here's the point that I want to make. In the context of this environment, who's the priority? Is it Babu? Who's the priority in the context of this environment? The children, right? Is there any doubt who the priority is in this environment? Zero doubt. Zero doubt who the priority is in this environment. In the context of this environment, I think we still have some questions to answer. In the context of this environment, I think there's still an open question to our young people. So, how did my grandchildren change the way I view the work that we do? For me, prevention is about identifying the most vulnerable in our population and identifying where they are most vulnerable. In other words, the environments that place them at greatest vulnerable risk. You know, kind of like the top of the stairs represents an invisible vulnerability for that most vulnerable population. And most importantly, prevention ought to be obvious, blatant, overt even, like intrusive. Right? Not something that we have to figure out what is it that we are doing, but rather that everyone should have no doubt who the priority is in the context of the society that we are working on behalf of. Does that make sense to anybody here in the room? And so as we think about this, what I would ask you to consider is that prevention goes across the lifespan. And as we're looking at these developmental opportunities for us to make prevention blatantly obvious, I was so impressed with the work that I saw that you all were doing here in the state. When the CEO of Maine Health shared about the MOM program that I learned about in my studies, I became excited because you all are doing and thinking about this in real practical ways. You are looking for opportunities throughout the developmental lifespan of Mainers, and you're trying to identify places and areas in which you can make those opportunities blatantly obvious. And you're doing that within your strategic plan. And I'm a bit of a nerd about strategic plans. I kind of read them for fun. I do. Don't judge me, right? And so much so that I became a little bit upset when I found out that my research on the plan that I have has just been updated, and you all now have the doggone brand new plan. And so half of the things that I knew has already been changed because you all are already improving upon this all the time. Give yourselves a round of applause on that one. My goodness, I mean, part of what it is that you're doing is showing how, if you take a look at your plan, you will see where they are taking each of the things that we're sharing and illuminating them and making them blatantly obvious, making them actionable. And so, how does that all work with prevention? What I will share with you is that there is this remarkable kind of opportunity for us to think strategically and differently about prevention. So I just want to provoke a few thoughts for you. All right? And let me know when I have about 10 minutes left. Somebody get up and do some jumping jacks or something. You don't have to be shy. Just let me know. Right? But some of you may be familiar with this continuum of health. This continuum of care. Some of you may be familiar with it from the Institute of Medicine or the National Alliance of Medicine. With respect to this, science medicine. This is the continuum that they share for us that we ought to be thinking. And what I think would be helpful for us to consider is that we have traditionally looked at this as very siloed areas of health. There are those that are doing prevention, and then there are those that are doing treatment, and all in between. We have traditionally thought about this as siloed areas of support throughout my history in working in this field, but lately we have found that that has not been effective. And so it is helpful for me to think about it in terms of that middle line being the place where diagnosis happens. And everything prior to the line is where and how diagnosis occurs and the opportunities for us to intervene, utilizing universal, selective, and indicated prevention methods and methodologies, which I believe ought to be a core part of the strategies that you implement. We need universal primary prevention to be and receive some of the urgency around the support that you have. So you have some opportunities to consider and to think about those things as we also look at the fact that there are downstream efforts that are also recognized that we have to support. The thing that I want to share with you all is that this is all part of the same continuum, that we are all working collectively. And in states like Maine, where you are being thoughtful about how we can make sure that all of this is coordinated and all of this works collaboratively together, you all are doing the smart work of identifying that there are some real things that you can do here on this effort and incorporating harm reduction strategies throughout, where you are aligning your harm reduction efforts, your harm reduction strategies with those of primary prevention work that can be done. So we all need to think about prevention as a way of we're all doing this work, whether we're looking at it from a primary standpoint or whether we're looking at it as a secondary standpoint. We are all involved with making sure that we are preventing the problem before it starts. And this work is hard work, because the truth and the reality of this work is that it is really about bridge building that is occurring. It doesn't just happen because we all think it is a good idea. It happens because you have been thoughtful about the bridge that you are making. And let me share something about this particular bridge that you all are making, right? Because we are now in a new place in our society. It is the reason why you had the CEO of Maine Health and the U.S. Attorney and the Attorney General here of this state all on the same stage talking about the same issue, because now we are living in a time where public health and criminal justice has to work with each other, has to be a part of the same strategy. And you've been building that bridge. You've been building that bridge so effectively, whether or not you're talking about having prevention as the cornerstone of this bridge, right? So if you're talking about your options initiative, which is doing some remarkable work saving lives by making sure that law enforcement and public health recovery professionals are there working alongside to make sure that you're assuring your folks are receiving life-saving care in immediate time frames, or the Maine Resilience Building Network and the tremendous work that they all are doing in helping us to understand how do we look at the brain, and how do we look at trauma, and how do we look at things like ACEs and positive childhood experiences, and incorporating that, making sure that we understand the importance of helping our young people learn that they matter to us, and making sure that they're incorporated in that. At the same time, you have a remarkable institution that's doing the ground level work of helping ensuring that some of those populations that may require additional outreach and additional help and additional support are receiving that support by doing that. Those incredible recovery centers that are now expanding across the state, providing greater access for those that are in need, and at the same time looking at the exponential work that you're doing and ensuring that naloxone is being made available to everyone here in this state through the Good Samaritan programs that you all are promoting. And Gordon, forgive me for this, but I will share with you that your monthly webinar series has become must-see TV for us here in this state. It is doing a tremendous job. And those grassroots efforts like the Be the Influence Coalition that is doing some ground level work as a part of the Drug-Free Community Support Program. All of you, brick by brick by brick by brick by brick, building up the opportunity to ensure that prevention is at the forefront of the work and the efforts that you are all doing in a coordinated fashion. That just doesn't happen. And I'm telling you, I do this in every state, and this is unique here in this country. Give yourselves a round of applause. I think Maine should be a model for other states around the country. And if I can share with you that there is no more urgent time than now. We are living in fiercely urgent times. This has become increasingly important. We are all familiar with the opioid issues and challenges that we have, we know that it is also being mixed with the messaging that's going about in terms of how our young people are feeling about marijuana use. We're talking about the fact that there is a growing swell of voices that are now asking us to consider the things of hallucinogens as medications. And we've heard that story before, and we know that new psychoactive substances are coming into our communities in ways that are very, very dangerous. The mix of synthetics and stimulants and all that we are dealing with here in this state is not something that is unfamiliar to you, including the challenges that our young people have expressed around vaping. All of these issues were before the pandemic. And the pandemic has made every single one of those issues and challenges worse. So while you all have been doing tremendous work, and there has indeed been significant progress that has been made here in this state and elsewhere, we all know that a lot of the lines that we are paying attention to are going in an unwanted direction, requiring us to redouble our efforts and redouble our attention because this challenge has not gone away. And so we have to pay attention to those who are in communities that are not necessarily receiving the same amount of attention and the same amount of work and the same amount of outreach as others, including our tribal communities. I was working in Arizona, and there was a remarkable study that was involved with tribal communities and their work and their efforts with related to this field and this issue. And as I was looking at that study and as I was researching the work that is being done here in this state, I found out that many of the tribes here are expressing the same issues and challenges here in Maine. There are populations that require attention. And so I had the great fortune of working with the Drug Enforcement Administration in the capacity of supporting an effort that at one time was referred to as Operation 360. It is now Operation Engage. And while I was doing that across the nation and working and supporting communities across the nation, I discovered some things that I believe are important guides for our thinking as we look at prevention, right? So I want you to do this. I want you to look at this picture. This was a remarkable community, great prosecutor in this community, the highest law enforcement individual in that particular community, who as a result of the opioid crisis had determined and decided that there were some challenges that they were having that required everyone's attention. And so he called a meeting to discuss this. And so can somebody look at this picture and tell me what you believe may be wrong with this picture? Empty seats, empty chairs, right? Not a whole heck of a lot of diversity and all, right? Which provoked me to start to think about who's responsible for the empty chairs. I mean, is it that in that community they just don't care enough? Or is the responsibility upon us to have a new kind of conversation? And I would suggest for us in prevention that conversation has to be about engagement. How might we reach beyond ourselves to ensure that the greater population is included in the conversations that we want to have? In prevention, we have worked the public health model approach. We understand it. We know it. We've learned the importance of defining the issues and defining the problems, making sure that we understand the context with those problems of risk factors and protective factors, and a comprehensive set of strategies that need to be employed with this. But how many of you will see that there is a fourth step? And that fourth step is where I believe that we as a field have to apply our attentions now. We've gotten real good at understanding the types of strategies that are work and that are important. But what we need to do now is focus our efforts on how we reach beyond ourselves to bring that greater population to bear so that everyone understands the vital importance of this work and the science that we find and we value. So I will share a few things with you. I'm going to start off by sharing this, and I'll let you know that I will skip over some slides for you. Don't worry about that. What I will tell you, though, is that these things are somewhat, I think, of value for the work that you all are doing. And I'll start off by simply saying, Hamjambo, hey, habari anu? Hey, Jambo, niva suri sana kuwa nyumbani. Ninyi ni watu wazuri. Mungu awabariki. Mambo sawa sawa. Mambo sawa sawa. Oh, come on, man. There's not a mambo or a sour in the bunch. All right. Is there anyone out here that at least can know what language I was speaking? Absolutely right. Yes, indeed. Absolutely. And so I'm the first of my family to have had the opportunity to spend significant time in the continent of Africa. And when Kenya was the very first place that I've ever touched, and I found out that I had a propensity for a language I'd never heard before. What I've said is I said, hello. I said, how are you? I said, thank you for making me feel at home. I said, you all look beautiful to me. Sorry, sir, I don't know the word for handsome. I said, God bless you all. I'm excited, let's get started. I'm excited, let's get started. I'm excited, let's get started. Now, was there anything wrong with what I said? Of course not. But it didn't elicit the response. Why? Because you couldn't understand what I was saying. I've been to community after community after community after community, and there is no shortage of folks that cared passionately about the work that we all are doing. And when they ask how can they be involved and engaged with the work and the efforts that we are doing, we say, sure, we're doing prevention. They say, great, how can I be involved? And we say, you can be a part of the strategic prevention framework. The strategic prevention framework is a 5-phase process that you can be involved with. And as you're doing that strategic prevention framework, you can also be involved with communities that care. Communities that care is another 5-phase process that you can be involved with. And if you're doing that, then there's also this other 5-phase process. We like 5-phase processes called collective impact. Collective impact means you have a backbone organization that you're going to start with. And if you're doing that very, very well, then you need to know the social ecological model. And the social ecological model doesn't mean anything without the social behavior, the social determinants of health. And if you don't have that, then you also need to make sure that you have an asset-based community development process and that asset-based community process works very, very well. And you do that with social development, there's 40 developmental assets, and those 40 developmental assets, you choose the social investment strategy, and the social investment strategy is guided by the social determinants of health. And the social determinants of health means that you have screening, brief intervention, and referral to treatment. And all of these things means that you're working in health policies. And if you have health in all policies, you put all that into context. We got to be better at this. We got to be better at this. So for us, if we're going to be better at this, I'm going to offer 2 thoughts, and then I'm going to skip a lot of slides and get to the end here. 1, for us to make sure that the role of prevention science is applied effectively, we have to work on clarifying what it is that we're doing. Our folks need us to translate this. Take that remarkable plan that you've developed that's extraordinary and think about how do you translate this in a language that your community members will understand. Does that make sense to anybody here in the room? Right? Then focus locally. I don't know Maine very well. I'm sorry to say, don't hold that against me. I'm trying my best to learn as much as I can while I can. But I do believe that there's a difference in the way prevention ought to work here in Portland than, say, a place like Lincoln. Does that make sense to anyone? right? And so if we are looking at this, we have to learn how to focus locally and define our strategic leverage, the variety of strategies that you all have to bear. How can we align that in such a way that you're creating leverage in order to move the needle at the population level? And lastly, we want to make sure that we're being thoughtful and intentional about engaging equitably, making sure that we are paying attention to those vulnerable populations that require us to spend a bit of extra attention to make sure that we're engaging. So, as we're doing this, I'm going to share a few things. If you wouldn't mind, read this out loud for me. Read it out loud. Yeah. So, I'm going to end with this couple of statements, right? Here's the point. Why did you do that? You did that because our brain works in a very specific way. Our brains are wired to fill in missing information so that we may be able to make quick decisions, right? Like way back in the day, I didn't have to see that line to know if that bush was rustling, I need to get up out of here, right? We do it all now. How many of you have ever decided you were going to stop off at the supermarket on your way home from work, but then find yourself in the driveway because you were on automatic pilot, right? It scares me to think how many folks are driving on automatic pilot. How many of you will agree with me that even though you now know what that says, you still cannot not see jumping to conclusions, right? If I were to ask you to read this, I'm sure you could, right? How many of you can read that? What if I told you it doesn't say that at all, right? And here's the point that I want to make. There are gaps in the way we may have been talking about the work and the efforts and the issues that we are doing, that we are working on behalf of, that may have us as a society jumping to conclusions. And so how do we ward against this? How do we fight against this? How do we make sure that we're not being caught up by this? I will say to you that as you look at this piece of data here, which is a vital piece of data, and it looks relatively same. This is from 2020. I'm not sure if there's a new one that's out yet. I think there might be an update. Thank you so very, very much for that, Taylor. I appreciate that. But I would suggest to you that the data is very, very similar. I've been looking at this over years. And what you see in that gray slice, the U.S. Attorney shared with us the importance of still thinking about the pharmaceutical opioids that are still a challenge for us, even though we've made tremendous progress with respect to that. Let me tell you where we have some real opportunity to make prevention blatantly obvious. It is that gray slice that says that 47, the great majority of folks are getting them from friends and relatives. That's in our wheelhouse. That's what we have the opportunity to actually influence. My late brother, his name was Khalil. He suffered from sickle cell anemia, which meant that he had chronic pain, excruciating pain in the joints all the time. That young man had every opioid that you can imagine at dosage levels that would frighten you, right? And he just took them like they were candy. But in my community where I come from, I'm from Philadelphia, in my neighborhood, most of us didn't go to a pharmacy if we had issues or challenges. We didn't go to a doctor to get a prescription. That costs money. We went to Khalil. And despite all of his great intentions, because Khalil swore that he could tell you, oh yeah, you just cut this thing in half, don't worry about this, you just take this, you can't take what I take, but you take this and it'll be okay. Did not realize and recognize not only how dangerous it was, but how wrong it was. How many of you agree with me that we have room there to actually do some work? with respect to the conversations and the communications that we have in prevention. And this is the last and most important point that I want to share. This conversation I had with Dr. Fishman, he's a friend of mine, was back in 2014. And what he shared at that time that revolutionized the way I began to look at this particular issue is he said, contrary to popular misconception, medical initiation is not the majority pathway to opioid use disorder. The fact of the matter is that the vast majority of persons with opioid use disorder have had previous trouble with other substances, right? Not so much news today, but it was radically different than everything that was being shared back in 2013, 2014. And what that shared with me is the fact that we are not looking at a singular substance issue here. Even your latest report, I told you I'm a nerd for your reports. Those monthly reports that you put out are vital information. What is it, maindata.gov? Is that what it is? Maindata.org? Maindata.org is a vital resource for this that I will tell you doesn't happen in most other states. The information, the treasure trove of information that you have in there is vital. And what you all found and said is something that we all know. Fentanyl is found in fentanyl is always found in combination with multiple other drugs, right? My good friend, Dr. Bob Dupont, said it even more clearly. He says there is virtually no drug overdose deaths where fentanyl is the only drug present. The fentanyl problem is 100% a poly-drug problem, polysubstance misuse problem. And if I were able to show you data, what I can tell you is that when young people get involved and engaged with one substance, like marijuana, for example, that those who say that they are utilizing marijuana, when they're asked if they're also using alcohol, 44%. Those same young people, when you say, are you using marijuana? And they say, no, we're not using marijuana. Look at the difference. And that's with every other substance, right? And before you start thinking that I'm picking on marijuana, I'm not. Because the same is true whether I'm talking about alcohol or whether I'm talking about other illicit drugs, including opioid misuse. Here's the point I want to make. This is an opioid response summit, but we might as well call it a polysubstance misuse summit. We have to get in line with assuring that we're not playing whack-a-mole by addressing every single substance that comes up as an issue, as a challenge. 9 out of 10 of those that are living with substance misuse issues and challenges will tell you that they started as a teenager with a single substance that was a pathway, maybe not a gateway, but was a pathway towards further substance misuse. We have to focus our efforts earlier. We have to focus them there. And so, if you don't mind, I will end here. Oh, God bless you. God bless you. Sorry. How do we do this? Oh, there you go. I was listening to one of your programs, Gordon. And what was amazing about that particular program was that you were introducing the strategy. And all of the remarkable folks were on there, all the professionals. Many, I think, of you here in the room may have been on that particular webinar. And when it came to the question and answer period, all of the professionals had profound comments and statements, and I was learning from each and every one of you. But there was a young man who decided to speak up. His name is Caden, and I don't know if Caden is here. I've never met Caden, but I remember Caden to this day, and I listened to that some months ago. I remember Caden to this day because Caden said something that was more profound than all the other professionals that I heard on that thing. What Caden said is that if you want to really deal with this, you got to start in middle school. You got to start early. I was seeing things at 11 years old. I was introduced to things at 11 years old. I may not talk real well, but I'm telling you, you got to start earlier than what you're starting right now. And that stuck with me. Caden, if you're here in this room, you are a hero. In fact, every young person that's under the age of 20, if you wouldn't mind, if you're in this room, could you stand up? If you're under 8, if you're under 20, if you're under 20, if you're under 20, could you stand up? Amen. I know I saw a bunch of them. They were here. They're taking a break. They were here. All right, here we go. Here we go. We have to get out of their way. We have to give them the tools. We have to step out of the way. Let them do the work that we have been trying to do. And I guarantee you that they will do it better. They will do it much more effectively. They will do it much more eloquently. In fact, if you don't know the latest TikTok dance, just get out of the way. Right? Here's the point. Get out of here. Get out of this. Boom, 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 boom. Let me do this so I can bring this to end. Had the great privilege of meeting one of my heroes, Congressman John Lewis. And we talked about bridge building earlier in this conversation, and bridge building is kind of the theme of this particular message. And there was a very remarkable bridge. My father was actually at this particular march. Sorry. Which is why I give honor to it, because I stand on those shoulders. And here's the point. He talked about getting into good trouble. We are all familiar now with that famous phrase. But what does that mean for us practically, pragmatically? I'll offer you these ideas. Number one, prevent drug use of any kind for adolescents. Young people are choosing abstinence right now. Let's support them in that effort. Let's challenge the myths and educate relationships and realities between commercialized polysubstance misuse that's taking place within our communities. Let's raise the banner because they're receiving mixed messages right now. Let's make sure that we're able to build upon and expand upon those post-overdose response capacities that we have developed here in the state by expanding upon the work that you're doing through your options initiatives and others as you're doing this work. Apply pressure by emphasizing equitable questioning as you're employing and looking at the social determinants of health as you're doing it. And most importantly, make prevention obvious wherever you go. For this to be disruptive in this state, we have to take all these things into consideration. So on behalf of Ethan Courtney and the twins, I know, right? That's Valentina and that's Carmen. They're 6 now. And on their 5th birthday, I promised all the kids that I was going to take them to Disney World. I'm broke now. But more importantly, you know, that's Tiana. That's the only African-American Disney princess that they had there. And my baby, Valentina, she loves Tiana, got this. And Tiana looked at her, saw her, and you see the joy in her face. And then as I was taking this picture, something hit me. And what hit me was that when my baby girls was looking at this Disney princess, with everything that they have in their being, they believed that they lived in a society where there were no hindrances to them achieving that vision that they had of themselves. And in that moment, I committed to redoubling my efforts to make sure that I am trying to find as many allies as I can to spread this message of prevention wherever we are, to make this world a place where we get closer to that reality. Thank you for who you choose to be in that fight. Thank you for all you're doing. And on behalf of my grandchildren, thank you all very, very much for your time. God bless you. So, thank you.